Okay, a building well hidden. Look at that, education building, another. But this building is moving. How you doing?
Not too bad, Charles. How are you?
Good, good. And you are?
I'm the nurse manager of the UNB Community Health Clinic.
And this is the Community Health Clinic.
Yes.
And it's been there for how long?
We've been here since December of 2002.
That long?
Yep.
And haven't been run out of town? Still?
No, it's been very good actually. This building is owned by the shelters.
Yep.
And the money was gotten actually through Claudette Bradshaw's initiative years and years ago, the homelessness initiative, where they gave money not only for shelters but for services to the shelter community. So that's how it got started. The house was renovated at that time to put in new windows and some of the plumbing issues so that it could be used as a clinic. And we've been here ever since.
And is it still Stackhouse?
Now, Dr. Stackhouse comes once a week.
Once a week?
Yeah, but we do all kinds of other things here because we have a nurse practitioner, so we do primary care here as well.
I've been in there, so I didn't have a doctor. I have a doctor now. And they're worse than me in there, the patients. They got 10 times more. They're more hyper than I am, if that's possible. And there's the workers there are heroes. Not bad people, the patient that goes there, but they're methadone, and then they're people with mental issues, but they seem to have everybody under control. And
well, I think everybody that comes here realizes that we're here to help.
Yeah.
And you feel comfortable coming here, so that's been part of our success, I think.
And lots of patients.
Lots of patients, yeah.
Lots of patients.
We have we've got almost 4,000 charts. Sometimes people only come once or twice, and sometimes we've had patients that have been here for the whole 10 years.
Now, you've been here, now you're well established in the community, now you're moving.
That's right. One of the problems was, especially when nurse practitioners started to practice, was that we ran out of space to do what we needed to do. So even though we're not going to have that many more people working with us initially, although that will grow, we'll be able to do more just because the space will allow us to do more easily. So anyway, so that's been an issue for us for a few years now. And so Horizon Health decided that they'd partner with UNB and renovate one of the wings of the Centennial Building into a larger clinic, and so we're going to move in there with them. Now,
I always said, I'm not a fan of the snobs, especially the bureaucrat snobs. Snobs and the less fortunate don't go hand in hand, but in this case,
I think, well, there was a primary healthcare needs assessment. I don't know if you heard about it, but a whole lot of people got together from the community and so on and really looked at what were the needs in the community. And one thing they found out when they did this study was that there were a lot of people living, particularly in the downtown area, that had issues around poverty, some of them homeless or near homeless, and other issues like the refugee population that we serve.
Yeah.
And what they also discovered, it shouldn't have been a big surprise, and I don't think it was a real big surprise, was that this clinic was actually serving a lot of those people. Mm-hmm. So they decided that they would partner with us. So we will still exist as a clinic. We have a lot of students, as you probably know. The nursing students in particular come here. We're also going to be able to accommodate more social work students and more medical students and so on. And so that part of it will grow. So it's really considered to be a teaching facility. And they understand that the people that we serve, if you can give them what they need in terms of primary care, then they're less likely to get sick and have to go to the hospital. It's good for the patients, good for society. Exactly.
And how are we going to handle the less fortunate around the Centennial Building?
Well,
I know the bureaucrats. I'm telling you, I was shocked when I found this out. But are they going to educate the bureaucrats? The bureaucrats going to see somebody hanging around there and say call the police or what?
No. One of the things that you'll notice that we've done is that there's a kind of if you go into the front door of the Centennial Building, you'll notice that there's a bit of a screen there where the commissioner's desk is, and that's only to show people that they don't have to check in with the commissioner. They just come straight into the clinic itself, into the hallway that leads down to the clinic. So if there are any problems, obviously we'll deal with them, but we have been talking to the commissionaires, and they know that this clinic served certain populations, and that they will be coming with us because they are our patients. So I think you're right. I think there's an education component.
Oh yes.
And I think also they'll be impressed when they see our patients and how they really are taking steps to improve their health. And so once that kind of message gets across, I think it'll be much better.
It'll be accepted. Like I always notice a division from the legislator side and this side here. And would the police be warned in advance if a snob calls and say, "I've just seen somebody hanging around the Centennial Building having a cigarette"? Would they rush there? Would they?
I wouldn't think so, Charles, because they know that we're going. Of course, because they renovated the space, the city had to be alerted to that because of building permits and so on and so forth. So they recognize that this clinic, which the police and everyone else has always known about, is literally not the house, but all the staff and all the patients are now going to be at that wing of the Centennial Building instead. So I don't see that there would be any difference than what we have right now. There shouldn't be. People are coming for care, and sometimes they'll be outside for a short time, but that's no different. There's we were checking out the park benches there today, and I thought, well, that's some place that people could hang out for a little while if they had to.
This is a positive step.
Oh, very
for the
much
community.
So. Absolutely, yeah.
This is, I'm sorry we tried to hide this issue for years and years and years, but there's the working poor, there's the snobby rich. You have problems, you got mental issues, and maybe we could work together on this. This is going to be a positive step.
Very much so, and everybody needs care, and some people actually need care more than others. So this is a way to make it easier for some people to access care. So
that's good.